specimen sampling for laboratory tests. So you need to make sure you've collected your supplies, the colored tubes that you're going to need, arterial blood gas, and the adapters for the sampling port. So the first thing that you're going to start with is you're going to go to your arterial line setup to the vamp. You're going to squeeze the sides of the vamp handle, securely hold the base here, and you're going to pull back and see the patient's blood, and you're going to pull back until it doesn't pull back any further, and then you're going to lock it in order to keep the blood so that when you sample it comes from the patient. The next thing you're going to do is you're going to take your adapter pieces and you're going to connect them together. Clean your sampling port for a minimum of 15 seconds. Then you're going to attach the vacutainer with the adapter on the end. Collect the first tube. And when you pop the tube, it will self-fill with the patient's blood. You take the tube off when you don't get any more fluid back, and it's collected everything that it's supposed to because it self-fills. Once you are done collecting that, and you've collected all the tubes, then you're going to collect your ABG. So you're going to remove the vacutainer. You're going to leave the adapter piece on it until you have your ABG syringe ready. Remove the cap off the ABG, remove the adapter off the vacutainer, and take and attach that to the ABG syringe, being very, very, very careful. Now, on a patient, when this is actually in their artery, it will self-fill. You will not actually manually draw back the blood. But I believe we are going to have to manually simulate. This is what it would actually look like. And actually, I can't even do that for you. So you're going to have to manually pull the blood back to about 0.7 to 0.8. Make sure to remove it with the adapter, not from the syringe. If you accidentally pull the syringe out of the adapter, arterial blood will go squirting everywhere, probably starting with your face. So you take it off with the adapter, remove the adapter, replace the cap, and then it'll be ready for transport as long as you filled it up all the way to there. All of these will be labeled and initialed and dated at the bedside, and not to be removed from the bedside until they've been labeled and put in a biohazard bag. Now you're ready to return your arterial line to its normal function. So you will open the stopcock back up. You will take and push the vamp down slowly while it flushes back in. It will not get all of the blood back in, so you will grab this little thing right here and you'll just gently pull on it until you have flushed all the blood out of the line back into your patients. Make sure to look at your arterial line waveform and make sure it's still functioning properly. Show you how to collect venous samples off a central line. What you see in my hand here is a quad lumen central line. I have collected the tubes. I need these two. I'm going to draw this as waste, my vacutainer adapter, alcohol pad, and saline flush. So the first thing that I'm going to do is I'm going to get my vacutainer adapter. Then I'm going to clean, and I'm going to use the most distal port, and I'm going to clean the hub for 15 seconds. All right, and then I'm going to take my vacutainer adapter and I'm going to attach it. I'm going to take my tube of waste and I'm going to collect, and it will self-fill, and once it's completely full, this will go in the trash because it's mixed the saline that was in the line with the blood. Then I'm going to collect the tubes that were designed to be drawn. Again, it will also self-fill until it is collected. And then Once I'm done with this, I will take and get my saline flush, take the top off, get rid of the excess air. Then I will come, take the vacutainer attachment off, take the cap off the top of the saline, attach my normal saline, and flush at least 5 of those milliliters in the line to clear the blood back into the patient. Then I will label my tubes accordingly, date, time, and initials, put them in a biohazard bag, and then take them for transport.